Okay. Welcome to the PRH video series on the mental health impact of COVID-19. We are talking with Herbert L. Eastlick Distinguished Professor, Dr. Maureen Schmitter-Edgecombe. She is a neuropsychology professor at WSU in the clinical psychology department. She also, full disclosure, was my mentor as an undergrad and a graduate student, and all around is one of my most favorite people on the planet. So I'm very grateful, and we're very lucky to have you doing this interview, so I really appreciate
Oh, you're too nice, Chad.
it. Also on that note, actually, I told Maureen I was going to tease her about anecdotes. So I don't know if you remember this from a long time ago. I teased you about this too, but Maureen has academic groupies. So there was a conference we went to at, it was Atlanta, I think, Nan, or maybe it was in Florida, but I can't, it was on the conference, it was in Atlanta, I think. And it was on the conference floor. And at some point, you would introduce me to a fellow professor that you knew, and I went to go get a drink, and I came back, and there was 4 students that were kind of buzzing around you, and one of them had, I think it was like an info sheet or something, and wanted your autograph, and I pointed out like,
Oh,
wow,
yeah.
you remember that? Yeah, and I could tell
No.
distinctly from your face that you're like, you got red, and we're like, oh, but I could tell that that wasn't the first time you've had that experience. So yeah, so in the world of academia, Marine having groupies, that's pretty well vetted as being a badass. So
I think that's
yeah,
a bit exaggeratic, but
well, the data speaks
okay.
for itself. But so Maureen is here going to talk about neuropsychology, and specifically the neuropsych impact of COVID and things to be considering about brain health and all things related. Um, so jumping in, just the broad question: what are some things, or how might people kind of improve upon or kind of maintain brain health in the current COVID context?
Okay, well, there's a lot of things people can do to help with their brain health. Things like getting good quality sleep, reducing stress, engaging in cognitive and social activities, exercising, eating well. These are all things that we're finding have an important impact on one's brain as well as on one's mental health.
How would you say? I mean, for the layperson, how might those activities actually improve brain health?
Well, we're still trying to understand the exact mechanisms, but we think that there's probably a variety of different ways that it may do that. So, for example, it may, engaging in a lot of these activities that are good for our brain health may actually help increase the number of brain cells. Or it may prevent some brain cells that are slated to die away. It may also increase the kind of density of the connections between brain cells. And all these things are good because they can help our cognitive functioning in terms of thinking faster or finding new ways to think about things using different brain cells.
Mhm.
And we do know that there is data that suggests that individuals who are engaging in these types of healthy brain activities show less cognitive decline and may even lower their risk of dementia.
Mm. So, I mean, that's a pretty important concept for people. And what comes to mind with this is, and I remember older adults in your lab asking the same question: is that the concept of exercising your brain is good for brain health? What would be the benchmark? How might people know that they're actually engaging their brain in that way that would satisfy that?
Yeah, that's a great question. We don't have a clear answer for that, but it's been suggested that what you really need to be doing is engaging in focused activity for about 20 minutes or longer, 3 to 4 times a day. And this activity needs to require new learning and problem solving. And so, what might be a cognitively engaging activity for one person might not be for another person. So, for example, if you know Spanish well and can speak it fluently, then trying to learn Spanish is no longer a cognitively engaging activity for you.
Mm.
Or, for example, my grandmother was so good at crossword puzzles. I could just say a question to her and she could give me the answer. So, for her, engaging in crossword puzzles was no longer requiring that kind of novel problem solving and reasoning, and so she needed to kind of up the ante a little bit and move on to something else that was really going to require her to think and problem solve.
So it's doing the same thing. If it's something that you've learned well or mastered, the challenge is important. Um,
Yes.
okay, and the newness, it sounds like too.
Yes,
Um,
that novel learning.
so what about things like lumosity? or
Yeah.
Prevagen, or well, Prevagen is a supplement, but brain health training. What about those programs?
Yeah, we get a lot of questions about that. And when you engage in those programs, you definitely get better at them, and that's all good for motivation and making you feel good. They're the programs haven't all been formally evaluated. And what we do know is that even though we may get better at doing those activities in these games, they may not necessarily translate into things in our everyday lives in terms of actually making our everyday functioning better. But I think what we need to do is think about them as just one aspect of things that we can be doing to increase our brain health and stay cognitively engaged. So if that's one of the four activities that you engage in that day to increase your cognitive engagement, then that's great. Just try to diversify what you're doing, and make sure that you're really doing that novel problem solving.
And thereby kind of increasing just how much you're engaging cognitively, and then also just diversifying your hobbies, um, which is
Yeah,
also
which is good for
important.
your mental health too,
Yeah,
right?
right.
Yeah.
Yeah, that makes sense. Um, okay. Brain health wise, another big factor with COVID that's coming up for people is drawbacks about social distancing, isolation. Um, let's talk about. I'm wondering about, from a brain health point of view, social engagement and the limited part of it now. The people are trying to kind of stay up, stay engaged. Facebook, this Zoom.
Hmm.
Is that important? Is that something that's yeah?
Yes, definitely important, both for your mental and your brain health. So there is data that suggests that higher social engagement is linked with things like better performance on cognitive tests and less cognitive decline. And we think this might be through mechanisms like, positive social engagement can lower depression, it can decrease stress. It might also even counter things like vascular risk factors like high blood pressure. So it is going to be important to continue that social engagement as much as you can. And if you think about it, when you're socially engaged, you're also engaging your cognition too, because you have to pay attention and maintain the memory and concentrate and recall past events. So you're kind of getting a double whammy there in terms of your engagement. And it's definitely more challenging now. We are seeing an explosion of different ways of trying to stay connected. So, like you said, FaceTime and Skype and Zoom. Um, my son one evening, all of a sudden, we heard him saying things like, "Pass the broccoli, chop the tomatoes." We're like, "What
What?
is he doing?" And he was on with a bunch of his friends. Now these are, college students playing this kitchen co-op game where they were all chefs and they were having to work together to beat this timer. So we all tried this as a family then,
Mm.
with our extended family, in Nevada and in Connecticut, and it was a real hoot. But there are ways to, you know, try and make these things fun too.
Yeah.
And if you don't have technology, you always have the phone. So
Mm.
don't be afraid to reach out to people and stay connected with the phone.
And these sound like all important ways to, even though there's limitations with staying home, ways to keep that engagement up. I mean, it's the I had a conversation with a colleague the other day about one huge not silver lining, but important thing is that we're having this pandemic now and not 30 years ago. But forget all the medical technology aside, just telecommunication it's a good time for it. Um,
Yeah, that makes a lot of good sense.
mhm. So, Dr. Schmitter-Edgecombe, so far what I'm hearing, and I want to posit a question about this the idea of cognitive engagement, challenging your mind, social engagement being ideal, and kind of keeping it fresh, keeping it new. If you mix all that together, kind of like with that kitchen time example you mentioned, which is adorable, by the way, um, video games. So I want to briefly just mention this. The video games, I'm a gamer, and video games have been something for a long time that were stigmatized. And from a brain health, I don't think you and I have ever talked about this, because I'm curious. Well, we have actually a long time ago, but I'm curious what you would say nowadays with this kind of stay at home and the platform of gaming, online gaming, things like Discord, which is kind of an online chat thing that's all about gaming and getting together. Would something that would meet the parameters that you're outlining so far be playing video games with friends online? Would that be a brain health positive thing?
I think so, just as long as you're doing it in moderation, right?
Oh,
Because if
yeah, those are the
if you do
magic
it
words.
too much and it messes up your sleep and your
Okay.
routine, then that part of it is not going to be good. But in terms of the social engagement and the cognitive activity, as long as it's novel and new and it's
Mhm,
stimulating to your brain without, like I said, overstimulating you and or
mhm.
causing stress, then I think that all does have some good benefits.
Okay. Well, the moderation piece, yeah, for so having a 10-hour video game session on a Saturday maybe isn't ideal, is what I'm hearing.
Yes.
Okay. Now you just mentioned sleep. So from a
Uh-huh.
brain health point of view, what kind of tidbits should people be aware of as far as sleep and the importance of it?
Yeah, I think this is a really important time to be thinking about sleep as days are all rolling together in terms of time. And it's really important to keep a routine so that you are able to fall asleep at night. There's lots of things that you can do to practice good sleep hygiene. So, you know, keeping the bed for sleeping is important. Trying to create that routine. So, my husband, for example, he gets up every morning. We both exercise in the morning, and he gets dressed for work and he sits in the office and he does his work. And at 5 o'clock, he goes back up and he changes out of his work clothes. So
Yeah, yeah.
he's really keeping that
Structure.
routine of,
Mhm.
yeah, like these are my work hours and this is when I'm doing my work, and trying to keep that separate from other things that are going on. But I think that that's also helping with him keeping a schedule. So, a good thing to keep your circadian rhythms in check. When you get up, try to expose yourself to a lot of light. If you
Mhm.
want to go outside and exercise or just get that light coming in, and then at the end of the day, try to make sure that you don't have the TV or the computer or other blue light producers like your video games on too close
Not a
to
wind down
bedtime.
activity. Yep.
Because that can interrupt your sleep. And then,
Mm,
of course, stress can impact sleep. So one of the things that I've had to stop doing is reading the news right before I go to bed, because that gets me kind of anxious and that's a
mm,
little stressful, and then it makes it more difficult to fall asleep. So trying to find some sort of pre-sleep ritual where you can relax, be mindful, maybe do some breathing exercises, whatever works for you, but just trying to keep that routine schedule so that your sleep is not getting too disrupted, because we know that good sleep is important to good brain health.
yeah, that makes sense, and it's something that, like the sleep hygiene, just what you just went over, it's not getting discussed that much either these days, and with everybody staying home, and I think of like college students and or people that have small studio apartments or things where their space is their bedroom.
Mm,
It's really important to do what you said about trying to demarcate, kind of get outdoors. Don't sit on your bed if you can avoid it, even. But all that when it stems from operant conditioning too. And yeah, the news piece, yeah. I mean, that's kind of the broad recommendation these days is to moderate that just in general, let alone it's not a wind down activity. So
right.
that's very helpful. Along these same lines, then, as far as sleep goes, brain health, you mentioned exercise. What about things like nutrition and exercise, that kind of piece of it?
Yeah, nutrition, that's a challenging one. Because we're at home now, right? It's so easy just to get up and go get something to eat.
Yeah.
Oh, I'm tired of what I'm doing, so I'm gonna go get something to eat. It's a little bit different when you're at work. So one of the things that I started doing is just choosing healthier snacks when I'm at the store. So there's not a lot of things that I can actually get up and eat that are not going to be good for me, except for chocolate. I won't give up chocolate. So we have plenty of chocolate in the house. Um, but trying to make sure that you're eating different foods too, getting in lots of fruits and vegetables, those whole grains, fish,
Mhm.
nuts, beans, seeds, lentils. We've got lots of lentils around the area that you can order. We just ordered some, I think yesterday we just put in the order from the Palouse lentils, and they're supposed to get here today.
Mhm.
um, so lots of interesting lentil recipes out there that you can try, and
You
then
want to
making
share
sure.
about your burrito recipe?
Oh, yes, yes. I have, my family actually likes this. This was a recipe I came up with. It's like a rice and lentil with broccoli and mushrooms in a burrito with cheese.
Mm.
And it was like an early way to get my son eating lots of broccoli and mushrooms.
That's great.
um, and then making sure that you're drinking enough water. That's one thing I'm always on my son about.
Mm.
Did you bring your water upstairs while you're doing your work, or are you drinking?
Yeah, water is like I've just over the years I just carry this around with me. Part of it's because part of what I do is talking for a living. But it's just really fundamental and for brain health too, obviously. So the I know time wise, we're kind of getting close. But this has all been really great information. And again, thank you for doing the interview.
Sure.
The pearls. What would you say is a takeaway or anything else that you feel like you really want to put out there for folks to be considering when it comes to brain health?
Sure. I think, based on the literature, if there was one thing I had to pick to make sure you do,
Mhm.
it's exercise. That's really where we have the most evidence for the positive effects on brain health. So don't skip it. Get it in there somehow in the morning, even if you have to start little. One of the things that my husband started doing just to get up and move around more was making sure he goes to the bathroom upstairs because he has to go up the stairs. So it's just
Mhm.
even those little things can just get you started. And they can also be good times to de-stress. So we make a point as a family to go on a walk at the end of our day just so we can talk. My son can stay off his phone for a little bit, and we have some quality time
Mhm.
during that. So really important. And then just try to do the best you can in terms of staying cognitively and socially engaged. Don't withdraw, reach out to others. um,
Mhm.
Watch that stress level if you need some support with your stress and how you're feeling with everything that's going on. Reach out and get that support.
Mhm. I just realized too. I had asked you earlier about lumosity, and then I mentioned Prevagen and got distracted because that's not a brain train. But I forgot to ask. So the programs like that, lumosity, brain train. There's a bunch of them. Um, what and I know you and I have talked privately about this, and but what would you say is kind of because this is a time where people probably, if they're staying home, they might have more time to think about ways to train the brain health. What would you say are some of the concerns about those programs and things that people should be aware of?
Well, I just don't think we have enough data yet. And like I said, even though you may get better at the task that you're, working on over and over again,
Hmm.
it may not necessarily translate into you being able to pay better attention in your everyday life or to do something faster in your everyday life. But again, if it's part of kind of a variety of different things that you're doing, then it's not necessarily a bad thing. It's better than not doing something. But I wouldn't want people to think that because I'm doing this, it's going to make my brain and my cognition necessarily better. And that may not be the case. We just don't have enough data for that.
I think that's really important information because and like I said, I know you and I have talked about this before, but there's to date, there's just to echo what you're saying, there hasn't really been strong evidence that it generalizes, just like you're saying. And so, because if it did, we'd all be doing it. So,
That's right.
yeah. So that's just when people are thinking about that, especially now with brain health and they have time on their hands, is maybe think about especially the ones that cost money. Is be thinking critically about that.
Right. So,
Um,
reading a book, playing card games, learning new games, learning a new language, learning a new musical instrument, learning to knit,
mm.
all those
Yeah.
things, scrapbooking that maybe you've got sitting around. Those are all great things. Gardening. Those are all things that involve
Mm.
cognitive engagement and also some social and physical for some of the others too.
Mhm, and meaningful output too. I mean, you end up like
Mm,
gardening, you have a product that you get to eat, and
right.
hopefully it's good.
Health
Yeah,
nutrition then
yeah.
too.
Oh, yeah, exactly. Ooh, well played. um,
Depending on what you grow. At
yeah.
least you can't grow chocolate, so that's good.
Yeah, or if you're like me, what you can grow. Um, well, one thing I've been asking everybody, if you're comfortable, is maybe speak to how COVID has impacted you personally or your family. If you're again, if
Okay.
you're comfortable.
Yeah, I mean, I feel pretty lucky actually. There were some unfinished things, such as this is my sabbatical year, and I had a little bit more travel that I wasn't able to do. And we also had a bathroom remodel. So we have tiles and flooring sitting in our dining room that is on hold now until our son ends up back in college, whenever that may be. So I think I'm kind of lucky in the sense that I never expected my son to be back home for an extended period of time again.
Mm.
So that has been a treat. So he's at that college on the other side of the state, which I won't mention.
Which college is that, Maureen?
But I'm really trying to enjoy, all this extra time with him. We're working hard to, keep a routine, to find things that we can stay engaged in, puzzles, time with family on Zoom. Um, I think my son is having a difficult time figuring out putting in the extra exercise. So he does the walks, and when I'm dragging him, he's doing all of that. But
Mhm.
he's so used to getting his exercise socially by playing sports with his friends. I mean, that's what he did every day.
Mm.
And so the non social exercise has been a challenge for him that he's
Yeah.
still working on. And because his mom is all about good brain health, he has to listen to
Mhm.
her saying,
Mhm.
you need to get your exercise in.
Mhm.
Um, I think as the weather gets warmer, I think that's definitely going to be a challenge because I like to be on the go and, trying to stay local and, make sure we're being safe and not putting ourselves or other people at risk. And trying to, adjust and adapt as things change. Um, my husband, the first, I think 1 or 2 weeks where there was so much uncertainty, he was so stressed because we were going to go away, we were going to start a remodel, and I just had to start making these decisions. No, this is going to be on hold. No,
Mhm.
um, but I'm okay with kind of like going day by day and figuring things out. And that was very stressful for him. Luckily, he has settled down, and my son's more like me. He's just kind of, it is what it is. And he's going with the flow. And luckily, he's a junior. So he's not missing out on a lot of those things so many people are, the graduations and
Yeah.
couple people that I know have had deaths in the family, and
Mm.
so there's a lot of stuff like that that I just feel for so many people, because things are really difficult for a lot of people, and we just happen to be pretty fortunate right now.
Mhm. Well,
Yeah.
Maureen, thank you very much for doing the interview. As per usual, it's always a pleasure talking with you.